Okay, to start, can everybody just like raise their hands to prove that there's 5 people in here because I can't see Zach?
Oh.
Okay, cool.
5.
6.
6.
Okay, so what is nuclear medicine? I know all of you have heard me say it at least once because you're all my friends, but nuclear medicine is a specialized branch of radiology that uses radiopharmaceuticals to either treat or help in the diagnosis of a disease or condition. According to mercycare.org, nuclear medicine helps physicians diagnose diseases earlier to make treatment more effective and it is the best early system for different kinds of heart disease, thyroid disease, tumors, bone changes, and more. So first I want to go over a brief overview of how nuclear medicine works, the radiopharmaceuticals that are used, what to expect whenever you have a nuclear medicine procedure scheduled, and the risks and benefits associated with nuclear medicine. So this is a gamma camera. The radiopharmaceuticals that are used in nuclear medicine will emit gamma rays that will be picked up by this gamma camera, and in turn will turn it into a 3D image through processing. A radioisotope can either be swallowed, ingested, or inhaled. This is a pig and an ammo box. These here, the red pigs, are what the radiopharmaceuticals are stored in. According to Society of Nuclear Medicine and Molecular Imaging.org, the radiopharmaceutical used to evaluate the anatomy and condition of a patient's bone is technetium-99 metastable NDP. Each radiopharmaceutical will have its own separate protocol that will be used depending on the patient and what their condition is. And this is the bone scan that I talked about earlier. This is a different protocol that can be used with a different radiopharmaceutical called DAT-SCAN. It uses iodine instead of technetium. Next, I'll talk about what to expect whenever you have a nuclear medicine procedure scheduled. Your doctor will give you orders before that you'll need to follow. You can either fast or you may have to take laxatives just depending on what procedure you have. Whenever you get to the nuclear medicine department, they will talk to you about the procedure, ask you questions about your previous health history, and if required, if you're getting injected with your radiopharmaceutical, they'll start an IV. Depending on which procedure you're having, it may require you to wait in between your injection time and the pictures that are actually taken with the gamma camera, or you may be already on the table and get injected and have the pictures started right away. According to radiologyinfo.org, the small amount of radiotracer in your body will lose its radioactivity over time through the natural process of radioactive decay and excretion from the body. Drinking plenty of fluids will be important to help the quick excretion of the radiopharmaceutical. Although nuclear medicine procedures may be intimidating just because of the name, they're really not that bad, and usually they're pretty standard for the people that are going to be helping you. Lastly, I want to talk about some benefits and risks associated with nuclear medicine. Although it may be a little bit questionable at first, the protocols are actually very beneficial and will provide very low risk to the patient. According to StanfordHealthcare.org, nuclear medicine imaging procedures are among the safest diagnostic exams possible. The dose of radioactivity is so relatively small that generally speaking, a diagnostic X-ray has comparable or even higher rate of radiation to the body. And according to radiology.com.au, allergic reactions have been reported, although they are very rare and usually minor. It's also important if you are pregnant or breastfeeding to let your doctor know, because normally we do not want to do any nuclear medicine protocols on a pregnant or breastfeeding woman, just to decrease the exposure rate to the fetus. So overall, nuclear medicine has very low risk rates, even though it seems a little bit scary. The radiation that we use is not much higher than the normal radiation that you are exposed to on a daily basis, and the benefits are outweigh the risks.